Hi, I'm Lizzie. I'm one of the trauma and orthopaedic physiotherapists here at Ysbyty Gwynedd. I'll be seeing you before and after your joint replacement surgery. I'm here today to talk through the exercise guides that we will be going through with you following your joint surgery. So these are the sheets that we'll give you specific to your knee or hip replacement. These exercises are really important for the outcome of your new joint. So we're going to be aiming to do these exercises 4 to 5 times a day. And you can build that up gradually on discharge. It's really important you don't just do them when you're in hospital here with us. You follow it up when you're at home and you build yourself back up to your normal activity level. Okay. Ideally, these exercises would be great if you could start them before coming in for surgery. That means that you get your head around what you needed to do and you get those muscles stronger. This will mean a better, faster recovery. Okay. So to start, we're going to go through the knee replacement exercise guide. So we're going to aim to do these 4 to 5 times a day following your surgery, and I'll talk through how many repetitions of each exercise we're aiming for as we go along. Okay. So simply, first of all, it's ankle pumps. So all you're going to do is just get your ankle going up and down, nice and easy. This is a nice, easy exercise. It shouldn't be painful. So you can do these throughout the day as much as you want. It works to get the blood pumping through your calf, helps reduce risk of blood clots, just helps the blood flow. Okay. The next one is called inner range quad. So that's working on activating these quadricep muscles. Very important following your knee replacement. So what you can do, without a towel to start, you're just thinking of pushing the back of your knee into that bed and you're activating these quad muscles. Okay, so you'll feel these muscles go a bit firmer. This might be quite difficult to start, but it will get easier the more you do it. So when you push your knee into the bed, you're aiming to hold that for 5 seconds. Okay. Once you get going with that, you can put a towel under your knee. There you go. And then when you push the back of your knee into the bed, you're expecting your heel to come off the bed slightly. And you're holding for 5 seconds and then relax. Okay? It doesn't matter if you do it with or without a towel. It's just preference. You're aiming to do 10 of these exercises. Okay? You can do them on both legs. All right. The next one is a similar exercise. It's called a straight leg raise. So again, you push the back of your knee into the bed and then you're aiming to get your toes up to about where my hand is, so a few inches off the bed. Hold for 5 seconds and then relax and come back down. Start aiming for about 5 repetitions of these and build it up as you go. This one is likely going to be the hardest one and something that you're aiming to do, it'll come over the next few days. All right. Then we're getting the knee flexion going. So this is something that's really important for you to get home. So we want to get your knee bending as much as possible. It's going to be stiff and it's going to be sore to start. So it's quite straightforward. So all you're doing is you're just going to bend your knee up and bring it back to as far as comfortable. Okay. So we're aiming for 80 to 90 degree flexion to get you home. All right. And then you're going to bring it back out. And again. Okay, and back out. So again, with these, you want to try and build up to 10 repetitions, but it might be that you're doing 3 to 5 to start and just building on that, okay? If you're struggling, you can use a plastic bag under your foot. So if I put this under your foot, and then we're going to bend the knee up and down. And it'll just help that foot slide along the bed a bit easier. All right. Good. So these are the exercises that are on the front of the exercise sheet, okay? So now we've turned the page on the exercise sheet and we've gone into the sitting exercises. So the first one is seated knee flexion. So similar to lying down, but now you're in seated. All you're going to do is you're going to bring your leg forwards and then you're going to flex your knee. You're going to bring it back. So flex your knee, bend your knee, and then forwards, okay, and bend, and forward. This is something you can do throughout the day when you're sitting in your chair, something you can build up again. So aiming for 10 repetitions, and again aiming to get that bend as good as we can. If you're struggling with this one, you can use the bag again, just under your foot, and all you're doing is getting it bending. And forward. All right. Don't worry if you're not getting to this degree of bend yet. it'll come. Okay. So the next exercise is a seated straight leg raise. So similar to lying again, what you're going to do is you're going to straighten your leg, so activate these quadricep muscles. So you're thinking of pushing the back of that knee back, and these muscles should become firm. All right, so if you activate your quadricep muscles and you're getting your leg as straight as you can. All right, again, aiming to hold this for 5 seconds and aiming to build up to 10 repetitions, and relax. Don't worry if your leg isn't fully straight to start with. It probably won't be, and you might expect a bit of a lag if I just show you what a lag would look like. So you might expect a little bit of a bend in your leg when you're trying to get it straight. That's normal. That will come with time when swelling settles and all the inflammation settles down, okay? But just keep working at it because it will improve. So then the last exercise we want you to be working on is standing knee flexion. So you want to be holding on to something sturdy like the back of a chair or a worktop at home. And what you're going to do is you're just going to bend your knee up behind you. Okay? And so start working the hamstrings and also work on that knee bend. Again, this movement will come with time. Very important you work on it. So if you bring it up and if you hold it for 5 seconds, it just gets those hamstrings working. It gives the front of that knee a good stretch, and then you can come back down. You're aiming to do about 10 of these. These shouldn't be particularly painful.